Muy buenos días a todas y todos y muchas gracias por
Good morning,
acompañarnos.
everyone, and thank you very much for joining us from so many different countries of the region. My name is Pablo Ibarraran. I am Chief of the Division for Social Protection and Health at the Inter-American Development Bank, and on behalf of the bank and the Fundación Astur, I'm pleased to welcome you to this webinar on training of caregivers in skills for person-centered care. The event will take place in Spanish and will have simultaneous interpretation into both English and Portuguese. As we know, the accelerated process of aging of the population of the region, which itself is very good news, also entails the challenge of the increased number of people who need care for their day-to-day activities. Today in Latin America and the Caribbean, almost 8 million persons over 65 years of age need care. To supplement the services provided in the family, mostly by women, with professional services, 5 million paid caregivers are needed. Just as important as having enough caregivers to address this growing need, well, it's equally important to ensure that they have the skills needed to provide quality care and also to take care of themselves. That is why the training of caregivers is fundamental and one of the main components of care systems. And so I'm happy to present to you the recent publication of the bank, Professionalization of Caregivers, Training and Skills Necessary for Long-Term Care, which we worked on together with the Fundación Astur, and which you could download now with the QR code that you can see on the screen or through the link, which will also be shared in the chat of this webinar. In this webinar, we will be sharing some of the findings of this research. Now, to begin the event, I'm honored to introduce former president of the bank, Enrique Iglesias. He will offer opening words. He is founder and president of the Fundación Astur. He served as Secretary General of the Association of Ibero-American Countries from 2008 to 2014 and president of the Inter-American Development Bank from 1988 to 2005. He left a major mark on the bank, as we could see when he was visiting the offices last year, and it was truly a pleasure to receive him and to work on those issues which are so important for him. I now give you the floor. Thank you so much
Muchas
for being
gracias,
here.
Pablo, y muchas gracias a
Thank you
todas
very
y
much,
todos
Pablo, and I'd like to
por
thank all of
este
you
seminario, este encuentro,
for this
donde
seminar, this meeting,
se recogerán las conclusiones
which
de
will
este
pick up
proyecto
on
de
the
formación de
conclusions
cuidadores
of this
mayores en nuestra región. Estoy
project
muy
for
contento de
training
que el
caregivers of older
banco
persons in our
siga
region. I'm very happy that the
impulsando este
bank
tipo de
is continuing
iniciativas,
to give impetus to
porque
initiatives
en el
such as
ADN
this
del banco está el tema social, el
because
compromiso
the
con la sociedad.
social issue and
Y este
commitment to social
compromiso con los
issues
mayores
is part of the very
debe
DNA of
seguir
the bank, and this
formando
commitment to
parte
older
de la
persons
agenda de trabajo de este
pleases me a great
instituto.
deal, and it is part of the
Nosotros en
working
nuestra
agenda of the
pequeña Fundación
institution.
Astur aquí,
In
nos
our
hemos
small Fundación Astor
preocupado
here,
de tocar
we
distintos temas
have
vinculados con
been
los mayores, que es el
concerned
tema
to
central,
touch on several
junto
issues
con
having to do with older
aspectos
persons,
secundarios,
which
otras
is
actividades, pero
the
simplemente
key area of our
decidimos
work.
que este
We
tema
knocked
es
on
un
some
tema
doors, but we
importante que debe
decided
estar
and
sobre la
explored
mesa.
some different issues, but we decided
Como se
that
han
this
dicho
was
los
the issue that we
ingredientes de
had
esta
to
manera,
focus on
Pablo,
most.
vamos a tener,
Pablo has
las estadísticas nos dicen
noted
que vamos
that the
a tener
statistics tell us that
el
we're going to have
25% ya por la mediados de la década próxima de
that by the
personas
middle of the next
vinculadas
decade,
al
25% of
cuidado
all
mayores, como
persons
mencionaba, una
will be
de cada cuatro
older
personas
persons.
ser mayor.
One of every four people will be an
Es un
older
proyecto
person.
de una enorme
So
significación para la
this is
sociedad
a
como
commitment
conjunto,
of
¿no?
the
Y vamos a
utmost
lograr
importance for
mucho
society as a
con
whole,
apoyo de
looking at
la
demographics,
gente que trabaja se va a ir reduciendo
looking
y
as the number
tiene
of people
problema
in the
serio
working
por
world
aquí que
reduce. Well,
nosotros
the world is
para
facing serious problems.
asegurar la calidad de
What
vida,
can we
Pablo, pero
do
ciertamente el
to
primer tema es
ensure
el tema
quality
de la
of
seguridad
life?
social, que hoy es el gran dolor de
And
cabeza de muchos
well, Social
países.
Security is the first issue, no doubt, and that's a headache
Pero
for
vamos
many
a tener
countries.
una nueva ley que va a actualizar
We also just had a new
muchos
law
temas de problemas.
to
Pero
update
creo
the
que por
approach to
encima de
the
todo eso
problem. But I
debemos ir
think that above
pensando
all
que
that,
hay un problema
we
de
need
mayores
to
y
realize
que
that there's
tenemos
already a problem
que
with older
revisar
persons, and we need
esta
to
agenda
see
también.
how we can shore up the quality of life of those older persons. I think that the care system is more or less at the origin of the project, a project that seeks to place emphasis on what is most important, well, on those who are caregivers for older persons. That's a very special profession for uh, those who come to this profession have a social commitment to help others live better. It is a employment-related commitment, but there's a personal commitment tied into all of this as well. I see that when it comes down to it, this cooperative effort has been extremely important for us, particularly in the cases of Colombia and Costa Rica, where different institutions joined to address this topic. As I say, I think that the issue of older persons should be a key concern when it comes down to it. I'm defending my own group. We older people constitute a group of people who can make a contribution from who we are, and I think that it's important to care for the older population. Training is fundamental. Any sort of profession has to have a vocation. This one is very clear. It's hard to be a caregiver for older persons if you don't really like the issue and make a commitment to the issue, to this work. Now, in terms of the experience of the project from which we received support from the bank, the idea is trying to train and prepare older persons or those who care for older persons so that they are committed but also upgraded in their professional skills. Also, life is telling us that we're going to have more and more older persons without having the direct support that they used to have from the families because people work, or because they might leave and go live elsewhere. At any rate, this is an issue. We need to pay attention to it, and we need to work with groups of caregivers who are truly committed and who get professional skills building. I'm glad that the bank liked the project. The idea is to emphasize the experience we've had and see how we can train people to care for the growing number of older persons in the world. And this is no small thing. The other day, I was meeting with a group of young people. These are things that sometimes go unperceived, but that the world took 2,000 years uh, to have so many billions of people. Uh, uh, so it took us so many years to have 2.5 billion, and then in such a short period, 75 years, we've gone up to practically 8 billion. So the number of candidates for problems are there. So I just want to say I'm most grateful to the bank. I'm very happy with the collaboration that we've had with the institutions, both in Costa Rica and Colombia. And I think we all need to learn to work together on this. We all have something to learn and to draw lessons from this. So I'd like to thank the IDB. Keep working on these issues, which are the issues that really reach people. And let's go on and onward. So thank you so much, and may you have a successful meeting. Thank you very much, President Iglesias. I think you've pointed out several issues that are fundamental. One, having a broad perspective on the whole question of the well-being of older persons. There's the issue of pensions, health care, other care. Last year, we had the publication. You were with us when we launched the report on aging with that comprehensive approach. And when we look at the issue of care, the fundamental question is who provides care and who cares for those who provide care. And to conclude my remarks, I would highlight something you just mentioned, which is the regional approach. As a bank, we have the capacity to work, and the fact that we've been able to work with the Fundación Astur, with Costa Rica, with Colombia, in addition to Uruguay, gives us that strength of being able to exchange experiences and really move these issues. It's a regional challenge, some countries before others, but the whole idea is to be able to learn from experiences had, which will be fundamental. I would now like to give the floor to Fiorella Benedetti, who is going to be in charge of moderating the panel. She's co-author of the publication, a key player in our team, so I'm pleased to give you the floor. You have the floor, Fiorella. Thank you very much, Enrique Iglesias and Pablo, and good day to all of those who are with us. I'd like to begin with a question, which is why is it so important to provide training to caregivers? Sometimes we get confused and we think that care knowledge is natural and that anybody can provide care. And it's true, we might all have intuition about how to do so, but quality care requires very specific skills that must be learned. This, of course, doesn't mean that people who've been providing care for years need to start from zero. The knowledge provided by practice is quite valuable and must be recognized, but we also need places for training, opportunities for training where we can review such knowledge and incorporate expertise. Why? Because education and training is one of the most important policies for having an impact on the quality of care. And as President Iglesias said, older persons have a right to quality care. There is a great deal of evidence that shows that when we provide training, this training is associated with an increase in the quality of the life of persons cared for, and also it sets back their institutionalization. This last point is extremely important because there's a great deal of evidence that shows that older persons prefer to age in their homes. Training, in addition to having benefits for those who get provided care, has benefits for those who provide the care. The survey in the publication that we're presenting today, well, in it we see that the vast majority of caregivers talk about attrition, wearing down, physically, emotionally, or both. It's important to know that one can get tools that help prevent this attrition, this wearing down, and to deal with it when it comes on. These are tools that
Además, también existe evidencia de que la formación está asociada a una reducción en la angustia, el estrés y la rotación de las personas cuidadoras y también en una mejora en la satisfacción laboral. Y es un paso para la profesionalización y la jerarquización de la tarea de cuidar, de la que también hablaba Enrique Iglesias. Como les decíamos al comienzo, existe una creencia implícita de que cualquiera puede cuidar y hay una valorización muy baja de la tarea de cuidar. Tenemos el gran desafío de cambiar esa mirada, de posicionarlo como un oficio con saberes específicos y obviamente seguir trabajando para lograr que el sector de los cuidados sea un sector con mejores condiciones laborales.
And also, there should be better conditions, safe salaries, and access to Social Security. Now let us move on to the next question. What is the situation like in Latin America today? The paid caregivers in their training, unfortunately, well, most of the paid caregivers in the region have little or no training. In the research study that we're presenting today, and it was carried out in Uruguay, Costa Rica, and Colombia, we see that almost half of those interviewed did not go through a training process. Moreover, 1 in 5, while they had training, there was very short training, less than 60 hours. It's clear that there are more than enough arguments as to why training is a fundamental part of care systems. And plus, we have a great deal on which we can improve in Latin America. That is why we are having this session today. We're with Florencia Krog of the Ministry of Social Development of Uruguay and creator of the foundation. We also have Andas from Spain, who is co-director and researcher of the Foundation Mas Institute. And we are representing the team that came up with this publication. Thank you, Monica, Alejandro, Laura, Elisa, and Ercuren for this great job. And we're also pleased to have today Carla Camareno. She is a caregiver in Costa Rica and very studious. She is a personal assistant for persons with disabilities and assistants, others, and therapist. Carla is one of the many persons who, in the course of the research, told us very openly about her work and her challenges. We very much believe that the policies for caregiving should be constructed, including the perspectives of older persons and caregivers. And so it's a pleasure to be able to hear from Carla. And also thank you I'd like to thank all of those who allowed us to transmit their voices through this research. So we're going to have a half-hour conversation with the panelists, and then at the end, we'll have a few minutes for questions from the public. And you can write them in the Q&A by pressing the Q&A icon. The first topic I'd like to discuss is the approach from which we provide care and training. Oftentimes, training places emphasis on the difficulties that older persons face. This research and the wise words of Enrique Iglesias are a call to put the person and their quality of life at the center. And so I want to begin with Erkuden, who is a point of reference in person-centered care, and ask her about this approach and what does it mean to provide training from this approach. Thank you very much, Fiorella. First of all, good morning, everyone. I'm pleased to be here. What is person-centered care? It is an approach to care. It's an approach to care that is based on humanist psychology, specifically client-centered therapy, which works as the basis of the therapy on the subjective experiences of persons, arguing that all persons, well, we all have the innate ability for our personal development, our personal growth, and that even though we may need support at different times in our lives, we are the ones who can best know what is the best response to the challenges, difficulties, and situations that come up in our day-to-day lives. And I would say that we are experts as a matter of experience. No one knows any better than ourselves what makes us feel good, what does not make us feel good, and so on. So this approach carries over into other areas, and in the area of older persons, it takes on the name of person-centered care. Person-centered care, in principle, pays attention to dignity, individuality, autonomy, and participation, among others. As you can see, these are rights that all of us persons have, with no exception, all persons. For me, if I had to say what it does this kind of training entail, well, it means to bear in mind these principles in each and every activity that we perform when we are accompanying persons, when we are providing care, bearing in mind the criteria that make it possible or operationalize these principles. And for me, summarizing it in just a short phrase, I think it means taking one more step forward with what we've done and everything we know how to do, but now we provide care in another way. We look not only to the needs of persons, but we also look at persons' lives. It means moving from caring for needs to caring for lives, understanding that persons' well-being is much more than being clean. It's much more than being well-fed, which is necessary. But to be well, we need to have significant relationships. We need to relate to other persons with our community of origin, for example. We need to engage in activities that make us feel good, that draw us into life, that make us get up eagerly to have a new to pursue a new day, and that one provide care in keeping with the values and preferences of persons, and with this focus on the life that persons have chosen, and position ourselves and situating ourselves, figuring out how can we accompany them so that this life can actually be realized. Thank you very much, Erkuden. What I take away is this phrase that we're not caring for needs, but persons. And I take the opportunity to ask Florencia, mindful of this definition, why do you think it is important to provide care and provide training from a person-centered approach? And what are the implications of this approach for those who make use of services? You're muted, Florencia. I'm sorry, good morning, everyone. Thank you very much, Fiorella, for your presentation. I'd also like to thank the bank I'd also like to thank the Fundación Astur, with whom we've worked closely in Uruguay. It's to move this forward program. The Fundación Matia, from whom we've learned a great deal and who provided a great deal of support as well. To describe this concept, I'd like to briefly cite or refer to the presentation made by Fiorella when she says that I'm not only the director of the care system at this time and for the last 2 years, but I'm also the one who created the Fundación Humanizadora Josefina, a humanizing foundation in its literal name. And this led me to pursue this route. This Fundación well, this is a tribute to my daughter Josefina, who died of cancer. And through that experience as mother, as caregiver, getting to know the healthcare models, first of all, and then seeing the care system for healthcare partners, looking to uphold the place of the patient, where Josefina, as a patient 10 years ago, asked for a notebook to write complaints so that she would be taken care of well. And so I become an activist in society looking towards a humanized model. I was able to pursue this path and learn more in Spain about what is humanization in caregiving. And this model, which was described so well by Erkuden, person-centered approach. And I was honored that the Minister of Social Development trusted me as a person from civil society to bring that voice of those of us who have received care and take that model to those who receive it. And being able to work on this concept of person-centered approach, thinking about the user who receives care, but also the caregiver. And in this way, we transform, worked with a very professional team that I'm in charge of, and continue to working. And I'll later have an opportunity to tell you how we carried out that model through dignity. What are the needs that the user who receives the care has, address those needs, and what are the needs as well of those who provide care, thinking that in order to provide good care to those who provide care, then we need to care for the caregivers. So in the last 2 years, we've created a manual or handbook for humanization, so the caregivers who are part of our care system can have tools and guides to take care of themselves in work that is so wearing. We'll hear from Carla exactly what this task entails and why it is so important for us to care for the caregivers. So thank you so much, Fiorella, for your presentation. You can count on us from Uruguay. Thank you very much, Florencia, for transforming your pain into a positive impact for Uruguay. I'd now like us to talk about what are the skills required for person-centered care. And the one who's an expert by her experience is Carla, and I'd like to ask you, well, as I mentioned, went through several training programs. What are the tools that you acquired? What is the transformation that you've experienced and that you are applying in your day-to-day work today? Good morning. I'm pleased that you've taken me into account today. I'm really proud to be here. Answering your question, it's a daily task for older persons to just get through the day today. We have an one objective, which is to devote ourselves to them so that they can have quality of life and to respect their autonomy, which is of the utmost importance. How can we respect that autonomy? Well, not by ignoring their desires and experiences, but rather stimulating them. Right now, I think of an older adult who I worked with who had arthritis, and that affects the bones of the feet and the hands. And this person was very frustrated when brushing his teeth because he was not able to draw the toothbrush to the mouth. He needed a few more centimeters to be able to do it. So seeking a support plan to be able to help him out and to be able to facilitate that activity, we sought out how we could adapt it. And with a piece of cardboard, we made the we made it a little longer, and then he was able to brush his teeth on his own, and that provided incredible stimulation. Think, how can we personalize care? By encouraging the persons we care for, listening to them, adapting ourselves to the moment they're at to make things easier for them, because we have some older adults who embroider, who cook, who paint, who have written books, and they get to an age where they get frustrated sometimes because they can't do it. And listening to them, giving them a bit of support, we can succeed in having them carry out those activities once again. First, I listen to them, then we try together. This makes it for an emotional connection. It's so important for them to feel useful and to become involved in day-to-day life like all of us. Thank you very much, Carla, especially for showing us that good training provides not only technical skills, such as how to provide support in oral hygiene, but also these emotional skills, such as how to accompany one in their day-to-day activities, how to have effective communication. I'd now like to give the floor to Erkuden and ask her, in connection with the publication, what are the main skills that good training should provide? Well, I think that the main one, not because it's more important, but rather because it's the basis of everything, we could say, is training people in a change of perspective, understand, recognize stereotypes, myths, and beliefs that we have associated with older persons because of their age, but also persons who require support, and get to know and understand what is the person-centered approach, what are the principles we mentioned earlier, and the criteria that make it possible. And I would say that one mistake that we've often seen when undertaking the study is that we have, with relative frequency, found a module devoted to person-centered care, but it is isolated without it having an impact on the rest of the training. So I think the first message is to understand that we start here because this is the basis of everything that we're going to develop afterwards. That is to say, this change in perspective, learning what person-centered approach is, the principles and concepts, and we're going to then apply it in all of the other activities and training modules that follow. Other skills in which we need training have to do with strategies and resources for professional performance from person-centered approach. We need to know, how do we get to know the persons? What tools can we use for that? How can we seek consensus with them? It is their life project, their life plan, and what support do they need to carry it out? There's another set of skills that has to do with personal care. And here I would like to note that perhaps as related to personal care, the more technical aspects of care, we have seen these in all of the curricula that we've analyzed. But I think that it's necessary to take one more step. We need to know how we can technically, properly provide hygiene care. Otherwise, somebody could get a urinary tract infection. Or we need to know how to make a transfer because we could harm the person we're supporting in that transfer or hurt ourselves. But now, this is necessary, but it's no longer sufficient. We need to know this, but at the same time as we know this or need to know this, we also need to know that when we're engaged in hygienic care, we're supporting a person in caring for their body. And we have said each person is different, and therefore each of the actions that we undertake in this regard will be different. And we'll adapt it in keeping with the tastes, the preferences, and the need for support that each person has.
Another group, or the final group, and I would like to underscore this because this is what's most necessary in the curricula and in the discussions we've had, it's come up more than once. That is training in personal skills for self-care and for teamwork. This is something that tends to not be touched on, but in order to be able to provide good care, we have to be able to work in teams. We have to know how to have good communication with other individuals, and self-care is also very important in being able to provide care to others. Thank you very much, Erkuden, and for reminding us that with PCC, we have to look at PCC, self-care. This all has to be cross-cutting. It's important for us to care for ourselves so that we can care for others. Okay. I would now like to talk about how to teach these competencies, how to teach these skills. In Latin America, we're seeing a revolution in the way we teach, a methodological revolution, as it were. For example, going to a more theory-based class to classes that are more practical, experiential. I would now like to go back to Carla and ask Carla what opportunities you see to improve the format in the day-to-day training that caregivers receive. In my particular case, I think, well, I began studying and I learned techniques. This requires a great deal of money because this was not a public education. So I started to get certified in different skills and I started to fall in love with each of these different skills. I really wanted to make sure I was as skilled as possible. A lot of this has to do with techniques and with practical training. I spent 3 years studying, and it may seem a bit absurd, but there were just 2 months of practical training in those 3 years. In my opinion, when I was gaining my various certifications, I saw that there was so much theory, and that's very important. I think it's important to understand the theory behind what we do. Nevertheless, when you put things into practice, they become clearer. I therefore believe that perhaps we could keep the theory more to a minimum and increase the practical and experiential training, because that's really how you learn. The training was very costly. I am a single mother of 3 children. It required a great deal of time. I worked Monday through Friday, and on Saturdays and Sundays, I had to travel several hours to do my training. I would have training from 6 a.m. until late in the afternoon. But the training was amazing. It was great to be able to provide care, to live with those we provided care to, because it's several hours a day, several hours a week that we spend time with them. And that's how I gained experience, much more experience than when I had been studying and becoming certified. So again, I would say we should lean more heavily towards experiential and practical training than the theory-based training. It's important. Again, the theory is important, but in the day-to-day, when you're working with families, when you're working with people who surround these individuals we're providing care to, we talk to them about the special role they play. And to be a caregiver for older adults is a great pleasure. I would say it is both a pleasure and a source of pride. I learn something new every day. I know that I am their support. I am there to make their lives easier. And honestly, I have no further words for this. Thank you so much, Carla, for your commitment to what you do. as well as your commitment to all the training, all the certifications that you obtained to be able to do your work. Carla underscored something I think is very important as far as training in Latin America is concerned. That they tend to be heavy on theory and light on practical and experiential training. And it's really in the practice that caregivers learn to do it, to perform better. So we're now concluding our block on training. And so we would like to hear about some of the recommendations that are out there now that we've heard about the experiences that Carla and others have had. As far as methodology is concerned, I think it's important to convey this idea that what PCC is about is moving from protocol to persons. Of course, they're protocols so that we're always doing things in a standardized way, but we need to tailor them as well. We need to have individuals who are trained, who have initiative, who can think critically, who can be resourceful and find solutions, because people are different and therefore the situations are going to be different. As we were heard, but in human psychology, you have to find out what is best for each individual based on the situation and provide support to that person based on those criteria. We have to provide training and methodologies that are very much based on reflection and reflection to make decisions alongside the individual receiving the care. Methodologies such as case studies or challenge and solution-based learning. We're seeing very positive results come out of this. And in Fiordella, we've seen this demonstrated in many studies and also those who we interviewed in the course of our research. People who want to learn by doing. And so to be alongside others who already know what they're doing and to learn from them. That's a great approach to take. Something we've seen in other curricula and we think is key, that they have to have practical training, that individuals go to the workplace and they learn on the job. They will make mistakes, but they will be there mentored. That very practical training based on the day-to-day and to work with some who are more experienced to learn on the job instead of spending so much time reading about theory or reading textbooks. In the study, we identified some of the difficulties people face in accessing training because they live in areas that are far away from where the training is given. They live in rural areas. It's not easy to get places or the need to arrange their schedules. Therefore, these formats must be very flexible. They could be in person, they could be virtual, they could be hybrid. We're starting to see hybrid training becoming increasingly popular. So some online classes alongside in-person practical experiences, also synchronous and asynchronous options. We also think this should be divided into modules. The idea is to create module-based training. So persons can become certified in different modules and then continue on to the next module. The idea is to have a phased training, so persons can do the training when they have time, and then they can move on to the next module when time allows. So it has to be more flexible. Thank you very much, Erkuden. And last but not least, I would like to turn to the tools and methodologies that could be put into practice by governments. Hortensia, I was wondering if you could talk a little bit about training in Uruguay. Thank you very much. First and foremost, I would like to commend Carla on her passion, congratulate her. I know it was difficult for you to obtain your training, but it's also for your passion and your compassion. That's something that we're always looking for. As to Uruguay, one thing I would like to underscore here is that the caregiving system in Uruguay it looks at uh, uh, older persons, but also children and adolescents who require care. This has to do with home care, and the national caregiving system training is required for anyone who provides home care. We have more than 7,000 individuals who have completed the required curriculum. It's called a course on caregiving. It has been required since 2015. It is not required for those who work in daycare systems, but it is required for those who provide home care. In Costa Rica, the system Carla works in is very similar. We have care for children, adolescents, and older persons. There are 40 hours of theoretical training and 12 practical training. But here I wanted to highlight the fact that we are working on a pilot program through the Matia Foundation and other foundations. From that extensive curriculum with 12 hours that we think are more suitable for PCC. We are going to be doing some training of the trainers so that all caregivers who are providing home care or long-term care in public institutions, allow them to implement a pilot PCC program and work with individuals who are already working. It's there's some there are people who are working 8 to 10 hours a day, and then they would have this extra training to provide them with tools so that they can work on self-care to prevent professional burnout. This pilot will enable us to see how much they grow and perhaps reach out to more and more people and bring them into the caregiving system. This is something we're implementing via the National Training Institute, as well as other institutions. We've provided training to several thousand people this year, and we're hoping to bring those numbers higher next year. But it is a bit of a light at the end of the tunnel for us. Thank you so much for Florencia. We hope that Uruguay is the first of many countries in Latin America to pursue this option. We see in Uruguay that when you combine training with support from the government and assistance to caregivers, these things can be so much better. We will have trained caregivers, and we know that those who work in the government-run system earn far more than those in the private system. Okay, we are now going to move on to some of the questions we received from the audience. We have so many questions and comments. Thank you to all of you. We're not going to be able to answer those, but we will cover as many as possible. The first is for Florencia, Colombia, from Maria, who asks what challenges are associated with implementation. Thank you very much, Maria, for that question. Wanted to reinforce everything at Kuden and Carla said. We have to professionalize caregiving and prioritize it more. I learned about caregiving firsthand. It's so important to give caregivers that role so that they know that we value their work. We've talked a great deal about unpaid work, paid work. It's not just about being paid for work, but it's providing care, providing holistic care, emotional care, physical care. And we know that there's a great deal of burnout for those in this profession. We have to professionalize it. We have to provide tools. Everything we've discussed this morning is going to be key for providing quality care. Wonderful. Let's continue with more questions from the public. I will read out 3 questions, one for each of you. So Ricardo Alberti asks a question that maybe Carla can respond to. So what space is given to the ability of a caregiver to be innovative in caregiving, and what types of tools are available? And then Maria del Carmen asks a number of questions. She says she talks about the professionalization. It said that takes several weeks, several months, might lead to logistical issues or financial difficulties. How can that be addressed? What would be the ideal number of hours of training for quality care? Then from Costa Rica, Yvette asks, and maybe Florencia can respond to this. She asks about strategies for validating the experience of caregivers who have been working as caregivers for many years now. So any one of you is welcome to respond first. If you'd like, I'm happy to go ahead. I'll respond to Ricardo. The possibility to provide care to older adults are legion. We train to support them, to facilitate their lives in every way, shape, and form. Autonomy is so important. We want them to feel like they themselves, at their age, their adulthood, it's just a matter of having lived more years, but they continue to be whole persons. What role do we play then? It's to reinforce the support so that they have a high quality life. I'm not sure if with that I've responded to your question. Yes, Carla, that was wonderful. Thank you. Florencia or Ercuden? Well, then let's just go in order. Before answering the question, I would like to underscore something that Carla said. This ability to be creative or innovative is something that has to be so present in PCC. When I provide training to those who want to become caregivers, I like to put them into positions where they have to think about what can I do? What's possible? And the possibilities are endless. As Carla was saying, we may be helping persons who can no longer do things that they used to be able to do. So how do we help that person to get as close as possible to the ability to do what they used to be able to do? Creativity, therefore, is essential. To engage in an activity, it's not about do I do it or I not do it? There are many ways to do it. Can I do something all by myself? Do I need a little bit of support? I may not be able to do it all myself. Can I do it with just a little bit of help? So we have to think about each and every one of those things. We have to rack our brains to see how we're going to be able to help. As to the question about how many hours of training are ideal, we have examined many different curricula, seen a lot of differences in terms of the amount of time, including in Latin America. They vary. Some are 1,000 hours, some are 100+ hours. We've also looked at these on a national basis. How much is enough? Well, for me, the answer is the more the better. But we have to be realistic. There are many difficulties, how intense the training is, issues having to do with somebody's level of schooling, their access to schooling, access to training, different gaps, financial issues, not enough budget given by the government. It's not always easy to provide the motivation. Even though caregiving is necessary, it's not always easy to encourage people to do this. We think what's important is that individuals have basic skills, but our training doesn't end once they hand us a certificate. It's continuing education, and that's something we should all be paying attention to. Different agencies need to pay attention to that. The curricula that we proposed in this publication are approximately 300 hours on average. We think that that's reasonable. How to respond to the different issues. If you'll recall, we talked about different formats. There are infinite possibilities, online, in-person, hybrid. Perhaps there needs to be a higher investment upfront, but then over time, you start to recover that investment, and then you can do it on a module basis. And so, okay, I'll complete this module, then I'll move on to the next one when I have time. All of this has to be taken into consideration in determining what the format for training will be in each different country and in each different agency. Thank you. Okay, I will wrap up then. We're being very orderly. In Uruguay, and the question on the strategy to make training compatible with work. This is a major challenge. There are so many people who have provided home care as well as care in daycare centers and long-term care. Look at training. There are a number of different partners and institutions involved, the different ministries, foundations, and thanks to the budget we were given by our training institute, we are able to cover this training. We provide training to approximately 300 individuals per year. That's about the average who we can certify in their skills. And then the public ministry, we have all those individuals who are caregivers who have been doing so for more than 2 years in long-term care centers. We invite them through Clay University and the National Training Institute to provide them with skills certification. They go to these long-term centers. They are evaluated, given performance evaluations. We make sure they have the skills needed. And again, this is approximately 300 certifications per year for individuals who have certain seniority and who have been working for several years. We consider their years of experience as something very valuable and very enriching. They have a lot to share, and we think that we can provide them with support as well. So we do work a lot on certification. We have also been working with the National Training Institute to see if we can bring more individuals into this training on a yearly basis. So that is the path we're going to continue to follow. Thank you very much. Thank you, Florencia. We have just 3 minutes remaining. I wanted to put 2 questions out there and see who wants to respond. We've received many lovely comments about Carla and her vocation. So the question is, in individuals with this vocation, and do you have to have a vocation or can just anyone who gets trained be a caregiver? And then another question, if in any of your countries are caregivers given any sort of break? In my case, I believe that more than a course or some sort of study, I very personally believe this has to be a vocation. Those of us who are willing to take on the drama that is entailed in being a caregiver. I can study anything I want to, but if I don't feel that vocation, how am I going to do a good job? If I don't feel any ownership, if I don't feel this affinity with those who I'm providing care to, how am I going to ensure that these people feel happy and content by my side? I think I would be frustrated if I didn't feel that vocation, if I wasn't always thinking about how I could do my job better. It's working, yes, in exchange for a salary, but there's has to be a passion there. You have to love what you're doing. That is at the heart of what we do. It's the love for your neighbor. I would like to just dovetail on what Carla was saying. Indeed, I think vocation is very important. But we should bear in mind what was said before, that caregiving in many cases is not that attractive. We see that in the foundation when we are trying to encourage young people, if they want to get into caregiving, and maybe not for older persons, maybe they want a different age group, but then we see things change once they start. Obviously, socially, caregiving it is not considered to be some sort of highfalutin job, and even though it's very valuable. But it's also the case of men. There are very few men who get into caregiving, but once we attract men to the profession and they start doing it, they find that they love it. So we're trying to bring more men into this. So I do believe that people can find purpose if you give them the opportunity. Sometimes it's just a matter of giving them the opportunity. Thank you so much to all of you for taking part in today's event. Unfortunately, our time has run out. Thank you for all the questions and comments in the chat. I would like to thank the IDB and Fundación Astur and your teams for making this possible. The recording will be available in the coming days on the IDB's YouTube channel. I would also like to take this opportunity to remind you that the publication towards the professionalization of caregivers is available for download. Thank you very much to you all, and we will see you again soon.
Muchas gracias. Gracias a todos y a todas.
Thank you. Thank you, everyone.